Let's talk about the treatment then. After all, the most important thing are the results. The theory is interesting but not important. Right. The important thing is how many patients get well.
Right.
And here's my definition of being well. They're free of signs and symptoms. They're getting on well with their family. They're getting on well with their community. And they're paying income tax. That's extremely important. They're paying income tax. In other words, they are working. They are gainfully employed. Now, if you put the same patients on tranquilizers, they hardly ever thereafter pay income taxes. They never get well enough to work. If I were flying on an Air Canada flight and I knew that the pilot was taking chlorpromazine or taking any tranquilizer, I wouldn't fly. But if I knew he were taking vitamins, I wouldn't care, because vitamins they don't prevent you from functioning as a normal individual. Okay, so that's my definition of getting well. Now, if you start out with, I'll give you the details, but I want to talk about 17 young men who in their teens were psychotic. They were treated by orthomolecular means all across North America. They all went back to college, they took medicine, and they became doctors. One of them was he's the son of a very prominent American writer, and he applied to Harvard Medical School. He wanted to take medicine at Harvard Medical School. They wanted him badly, because to get into Harvard you have to have not only money, but you have to have money and intelligence, and you have to have a name. That all helps. So he applied. He wrote to me before he applied. He said he wasn't sure whether he should tell the admissions committee that he had had schizophrenia or not. But at the end he said he had to be honest and tell them that what he had had. Now, the admissions committee didn't want him because they didn't want any schizophrenics, but they also wanted him because he had this famous name. So they said to him, "Come back, and we'll tell you tomorrow what our decision is." So the next day he came back, so they said to him, they said, "We know that you never get well from schizophrenia, okay? But you are well. Therefore, you never had schizophrenia." They admitted him, and he is now the head of a large pediatric clinic, doing well. Another patient of mine, he was very psychotic, and he was part of our double-blind controlled experiment. He went through the placebo arm, didn't respond, so we put him on vitamins, and he had the electric shock treatment as well. He made a complete recovery. He took medicine, became a psychiatrist, and eventually became the president of a large psychiatric association. President. The third one today, he is today head of a department of psychiatry at a major American university, but they don't know his history, so and he won't tell them, of course. And the last one was a young man that I saw 4 years ago, who came down from Alaska to see me, and I heard from him 6 months ago. He'd just been accepted for first-year medicine. Now, these are young, bright, intelligent, young teenage boys who, after their psychoses, went to university and became doctors. Now, that will never happen if they have been placed upon tranquilizers. Tranquilizers will not allow you, if that's all that you use, to ever become normal.